Well, thank you all very much for your efforts in keeping up to date. There's so much happening, and I think it's amazing how much we've learned on various topics. Certainly, when you take on new projects, it's exciting to learn. But here, when we're dealing with such a threat and such a catastrophe, it is so important that we're pulling together and trying to share information and also trying to decide what are the most important things we have to learn. Just want to double check the sound. Am I coming through okay? Great. Okay. As a professor at the University of South Florida, I do a lot of teaching. So this is going to be a little bit like a medical lecture, giving you some of the background information. But we always want to bring that down to the bottom line. I find that it's good to understand the background, but it's hard to remember. And I might be reaching way back to high school biology to describe a few things that it's going to be hard to remember that, but it does, for the moment, hopefully make a little sense on, what's going on with this disease and how the vaccine is protecting us and what are some of the answers to the common questions. So I'll try to share a slide there, and I hope that that comes through okay. Yeah, okay. And I do want to start off with just a little bit of a local update. What's going on currently, as some of you may have seen my lectures before, this is our incident command. Our organization has an incident command center that handles any kind of disaster or event or anything that's going on that's really critical to respond quickly to. And as a part of that command center, we have dashboards, things that give us up-to-date information. And as you can see here, this was probably done within the hour of the number of people that are in the hospital. Now, this is the entire hospital. So we are having a busy day, over 858 people in the hospital, and certainly taking care of many things: car crashes, heart attacks, stroke, things that need immediate attention. And we're able to do that safely while also handling the COVID and doing that in a safe way. Now, when you see some of the specific numbers, right now we have 101 people in the hospital with a diagnosis of COVID, and 10 that have their tests are pending. It's an important number to see there that this is a little lower than it had been about a month ago. And in the summertime, it had been almost 150, 160. So we are seeing this as a little lower. And I'll go back and compare to the summertime when the numbers were higher than they are today. So these numbers are come down a little bit. But I will make mention of the number of people who are more severely ill. We have about 12 people on a breathing machine right now who have COVID. And that's important because even that number is better. It used to be double. It used to be 24 or 25 on a ventilator in the summertime. So we've made advances in how we treat COVID. We're not seeing as many serious, but it can be serious, as you see. Now, just to know in general, we have other patients who are after surgery, other conditions that they're on a ventilator also. So we can also see how many ventilators in total are we using, and that's about 47 right now. And that's also well within our capabilities. So each of these patients are color-coded, so we know where they're located and being able to know the status. So that's important to know. I do want to take a little bit of a step away from COVID and just briefly mention, how does our bodies normally work when it comes to making proteins, doing our day-to-day jobs inside our bodies? Our bodies are made up of cells. And in our cells, you find our genetic material. So our genes are in each of our cells. And this is a picture of just a generic cell. Let's just say this is a cell that makes insulin, or it's a cell that makes hair or skin. Those are all examples of proteins. Insulin is a protein, skin is a protein, hair is a protein. Now, we all have different characteristics sometimes of our proteins that we get passed down from our parents, and that's all in our genes. Our genes are what we would call our genetic material. It's made out of a chemical called DNA. It has many little parts strung together, And in fact, I would say if you took this string of DNA, which is shown here in just a little picture, it actually would stretch for about 1 billion pieces. So you can barely see these little tiny lines in there, but it's a very long chemical, and it contains our code. And this DNA code is the code that makes us who we are, and it makes specific proteins. Now, I'll just show you how it happens. In the center of the cell, your DNA is a template to make other chemicals. And in fact, it's shown right here where the DNA is making something called mRNA. Now, I'll get to this later, but you probably have heard about this if you've been following the vaccine for COVID. But your body makes mRNA all the time, just unbelievable amounts of mRNA. It comes from your DNA. It's almost like not a carbon copy, but it is based upon the code. This mRNA is shorter, and it codes for one protein. So, for example, it's making insulin in this example, and this mRNA is the code to make the protein insulin. It's not a protein yet. It's a code for insulin. It goes out into the body of your cell, meets up with the machinery inside your cells that makes protein. Now, proteins are made of different parts, like amino acids. And when you make the proteins, it basically, the machinery reads the code of the mRNA to make a very specific protein. And in this case, this protein shown by the little balls is going to be insulin. Now, it could be hair, it could be the color of your eyes, it could be a number of things. But that's basically how your cells work. And then the mRNA that was made falls apart. It degrades. It doesn't last very long. So that's some important concepts to know, that this is what's happening every day in your body when things are normal. Your genetic material guides your cells into making mRNA, and that mRNA is the code to make the proteins that keep you alive. So that's a non-COVID sort of background story. Let me show you the enemy here. This is this here is the germ, the COVID virus. Now, I want to show, you've seen many pictures of COVID. It falls into the family of coronavirus because it's got these little crown-shaped things sticking out of it that looks that way. But this virus, this COVID virus, or they call it SARS-CoV-2, it's a coronavirus. It all looks pretty much like this. And I wanted to show this picture because how does it look shows you the different parts. But let me get to the really sinister thing that a virus does. A virus out in the environment, sitting on a table or on a doorknob, cannot duplicate itself. It has to be in a living tissue in order to duplicate itself. That is different than bacteria. Salmonella and E. coli, they can divide on their own, given the right conditions, and multiply because they're bacteria. But viruses have to be inside of a body, and the reason why is they take over the body and tell a body to make copies. So as it says here on the top, one virus comes into your body, gives instructions to your body, takes over your cells that it's invaded, and changes the instructions. And instead of you making proteins for yourself, you make the proteins of the virus. And it's very ingenious. It's sort of scary, but that's how a virus works. Cold viruses, all the viruses out there, one comes in, millions come out, and these will infect the rest of your body and then come out of you to infect other people. Taking a step back from that, I will show on this picture here that this virus is very delicate, actually. This blue part right here is actually made up of fat, and it's pretty delicate. And if you use just regular hand sanitizers and regular cleaners, it really destroys this virus pretty well. I mean, other viruses are made with even more protein and are hardy, where hand sanitizers don't work against some of those viruses out there, like the ones that cause diarrhea on cruise ships or hepatitis. Those are much more sturdier viruses because they have protein in this blue part. But this virus is actually pretty flexible and falls apart easily if given harsh conditions. So I did want to show that here. Now, it has these parts in there. Here's these red parts called spike proteins. There's this yellow part here. These are all the proteins that the virus needs in order to be infectious. These proteins, and they're not all shown, there's actually 29 different proteins that this virus makes. Some of them are proteins, others are enzymes, which carry out chemical reactions that the virus has to do. And this is really, again, ingenious, where these proteins, we don't even understand what these 29 proteins do for all of them. We know some of them interfere with your immune system, some of them cause inflammation, others of them cause the virus to stick to certain parts of your body to invade, which is what this spike protein does. Others might mess up blood clotting. And this is a lot of proteins. And where do they come from? These proteins come from the instructions that are inside the virus's genetic material. So that's getting back to that first slide I was showing you. The virus has its own genetic material. We have our own called DNA, and the virus has genetic material. It happens to use RNA. Some viruses use DNA, others use RNA. But here's the picture of the virus's genetic material called RNA. Now, it's not as big as a human's genetic material, which I said was maybe 1 billion pieces. If you look at these little lines here, they're trying to show you the little pieces. It's actually 30,000 little pieces all strung together in one long string or one long code, and they code for different parts of the virus. It's, again, 29 parts. Like this part right here might code for this yellow part. This part right over here might code for the red part, and so on and so forth. So that's how a virus works. It comes in with this genetic code. The genetic code is seen by your cells, and your cells act on it and follow the instructions to make millions of cells. And in the process, your cell probably dies in the process as it releases millions of viruses to infect other parts. I will make one other side note, is one of the tests we used to test for COVID to see if you're sick is actually looking for this little yellow piece. It's not looking for the whole thing, it's looking for a little piece of this genetic material. This is the test that you get when they stick that little cotton swab up your nose. It's not looking for the whole virus. It's looking for a little piece of the virus. And that is important to know, where it makes sense that if you've been exposed, you're sick, and they stick that cotton swab in your nose, and they find a little piece of this genetic material, it's pretty guaranteed you have COVID if it's positive. However, when you start to get better over the next 5, 7, 8, 10 days, the amount of infectious virus coming out of your body starts to go down because you're fighting it off. And if you have a mild to moderate case of COVID, your body destroys this virus after so many days. The magic number right now is 10 days. They feel that they've proven, actually, that the amount of virus coming out of your average person by the 9th or 10th day is no longer infectious. But what is coming out of your body is little pieces and fragments of the virus that cannot infect other people, but it's enough to cause the test to turn positive still, and I'd call that a false positive. So the moral of this story is, if you come down with COVID, don't get another test to prove you're better. It's going to be a bad information. So do not test yourself again if you're feeling better, just to prove that you're no longer infectious. They've already proven that by knowing that you're no longer infectious after 10 days with a mild to moderate case. It's a little longer if you had a more severe case. But the key is, we've seen a lot of employers insist upon getting their employees to get a second test or a third test and show that it's negative. Well, their test is going to stay positive for up to 2 to 3 months because little parts of the virus keep coming out of you. Now, I'm going to move on because we want to get to questions. So I'm going to very quickly say, many of you already know that there's people who get really, really sick with the virus. And I would have to say obesity has been the one that's been the biggest problem. Yes, other diseases are not good to have, like diabetes and high blood pressure, but we think that these folks sort of walk around every day before COVID with a little bit of inflammation going on. And when this virus attacks you, it tends to send things in a way that's not a well-balanced recovery. The virus might make them sick, but then we find out that these folks, their immune system is not as perfect, especially in older age. The immune system fights the virus, but then it overfights the virus. And in fact, the immune system actually starts getting in the way because it's fighting too strongly and doesn't know when to turn off. And then it's getting in the way of oxygen, and you can't breathe, and it's leading to blood clots. And people are dying of these complications of the immune system. So that gets to our treatments right now. Even though there's no cure, and we know that there's very little harm in giving vitamins for the most part, there is medicines like remdesivir, which is amazing in the sense that it's a fake building block of the virus. You give this medicine, and as the virus is trying to make copies of itself by telling your body to build more of it, you're giving the person a medicine which is a fake building block. It grabs this to try to build the genetic material of the virus, and it messes up the whole process. So if given early, remdesivir has been shown to shorten hospital stays and improve the outcomes. Now, we also know that your body is fighting this virus by trying to make its own antibodies, which is what your immune system does when it sees something foreign. It makes proteins called antibodies. Those antibodies can be collected from other people and given as a transfusion called convalescent plasma. Now, this has not been shown to be working as well as we'd like it, but it is safe, and it's still being used to some extent, but it's not on the top of our list anymore. It's fallen out of favor a little bit, but we still need more information. However, there has been designing very specific antibodies that are specific to certain parts of the virus, and one of them is called bamlanivimab, and it's one type of antibody, or a medicine that has two specific types of antibodies called Regeneron, and those are given early to help slow down the virus, and there's been some good news on that as far as working. However, once you're over the first attack of the virus, now we've got to worry about your immune system overreacting. And with an overactive immune system, with generating pus and all sorts of mess getting in the way of your recovery, we've seen that giving a steroid, a very inexpensive steroid, slows down the immune system and has helped people breathe better. And this is called dexamethasone, and we've been using that quite a while, and it's been shown to work in helping people. It's sometimes not even a medicine. Sometimes in the position you're laying, if somebody is getting very short of breath, we've actually laid them on their bellies, and this is called being in the prone position, and that has helped open up the lungs and get more oxygen in with less pressure. So even if you're on a breathing machine, people have been doing better if they're in the prone position. Of course, oxygen is an obvious treatment. I will mention, and I want you all to take note of this, is we are currently doing a study about something we're worried about nationally. We are seeing with people catching COVID, and as they recover over the next 45 days, we've seen an increased number of people getting blood clots as they recover from COVID. They've been small blood clots and they've been large blood clots. They've been in the leg, they've been in the arteries. If it's up by the heart, that's how a heart attack happens. If it's up leading towards the brain, that's how a stroke happens. And we've seen relatively young people have heart attacks and strokes because of blood clots as they're recovering from COVID. And right now, we across the nation are just sort of warning people to be on the lookout. If your leg starts swelling unevenly, that could be a blood clot in your leg. You need to get treatment for that because blood clots are treatable. Obviously, if you have chest pain or weakness on your side of your body or having trouble speaking, that's a stroke or a heart attack. You need to call 911. But we're doing a study here at Lakeland Regional, part of a national trial, to look at very common medicines, because right now we're not advising anything specific because we don't know what really works the best. But we are trying to find that out here locally. So what we're doing is we're randomizing people to either taking a placebo, which is what we're currently doing, which is nothing, or a baby aspirin in the morning, or a medicine that treats blood clots. So if you are interested in referring somebody for the study, please call me. I'm at the hospital. My extension is 1515, 1515. And this is for people over the age of 40 who have just been recently diagnosed with COVID within the last 10 to 14 days. And they're not already on a blood thinner or aspirin for other reasons. But this is an important part because we want to prevent complications in COVID, and probably has a lot to do with this long haul situation that we're seeing. All right, let's move to the end part here, the vaccine. I've given you some science in the background, so almost at a medical school level, and so you've gotten some really in-depth medicine that is maybe a little hard to remember. But let's get to the facts of the vaccine. The bottom line is that there's 3 vaccines available in the United States right now, made by 3 different companies, with a 4th one helping out. 2 things to remember: they're safe and they're effective. We've seen this used now in studies that were done on a large scale. Even though this had to be made quickly, because we're responding to a worldwide pandemic, they were studied over a shorter period of time, but they were studied in large numbers than you would have normally done if we had a ability to take our time, but we don't. This is an emergency. They've been able to be studied in tens of thousands of people before they were even released. So we've seen where they've been safe. We've learned about them. We've learned that there could be some allergic reactions infused. There can be some temporary side effects that I'll get to in a minute. We also know that they work. I mean, that to me was the most important thing for me before I would get vaccinated or recommended for my family is, well, does it even work? And they have been shown to prevent the COVID disease. So 2 very important points there. Forgetting all the science and the DNA and the RNA and the vectors and all that, if I'm in a conversation with somebody about the vaccine, I will first start off to say, these are safe and effective vaccines and they're providing this protection. And, if you catch COVID, we don't know how long you're going to be protected. Now, we're learning as we go forward. But if you catch COVID, we feel that you might be protected for a short time, but we don't think you're going to be protected for the long term for a few reasons. One is the virus does change itself over time. It mutates. The more people it infects, your body is not like a Xerox copier. You're not making identical copies in the millions. You're making some that are different or flawed or are mutated, and some of them may be even stronger or get around your immune system or be more contagious. So the sooner we can get the vaccines to stop the process of it getting into a person and making millions of copies, the better. So it is very urgent we get people vaccinated quickly to shut down this mutation factory called the human population, okay? Very important. So the vaccines are safe and effective. All 3 of them are. We'll make sure that, when people are wondering, should I get the vaccine? Should I get the vaccine or should I take my chances? I tell you what, when you start to study this vaccine and understand the germ, remember the picture I showed you of that germ coming in with that long genetic material that was 30,000 pieces, and it was coding and telling your body to make 29 different proteins. Some of them we don't even understand what they do. This vaccine comes in and only focuses on 1. So which is it, 29 or 1? I would rather get the vaccine than to take my chances with a virus that is hell-bent on making millions of copies in me, whereas a vaccine is just trying to get my immune system a little bit of heads up so it can fight off this virus if it invades me. So I would much rather get the vaccine because it is safer than getting the disease, which, as you've seen, I could catch a mild case of COVID and I could give it to someone else and they would end up with a stroke, or they'd end up not breathing or end up dying. And I don't want to be responsible for that. So I got my vaccine so as to protect other people. That's a key issue. It has been used in pregnancy. Granted, when they studied it, they did not study it specifically for pregnancy, but people did get pregnant during the study, and things turned out find. They did not find any pattern of problems. There was no pattern or reason to believe there would be any problem with fertility in the future or with a current pregnancy. And now we have given thousands of doses to people who are currently pregnant, because catching COVID while you're pregnant has not turned out well for some patients. So getting the vaccine has been chosen with patients who are pregnant, as long as they've gotten their questions answered and they felt that they were making an informed decision, which is the key fundamentals behind all this. So it has been used in pregnancy. If you've been infected, we do say you don't have to be in a hurry to get the vaccine if you've been truly infected recently, because there is some protection the infection gave you, and I would wait about 90 days. But again, great opportunity to ask questions about your unique situation. If you're somebody who's constantly exposed to COVID because of the job you do, maybe you don't want to wait the full 90 days. Well, you can still get it before the 90 days. It's just you need to go forward with it, understanding why it's being advised to wait, and is there things you need to know about. Now, of course, there are side effects with any vaccine. I'll make one comment that not all vaccines are 100% protective, but they have shown that your vaccine is protecting you against serious illness, hospitalization, and death. Although you may still catch COVID, and unfortunately, we've seen people get the vaccine and then go out and have a really good time the next 2 days, and they've gotten into crowded situations without masks, and they caught COVID before the vaccine could even have a chance of working. And so that brought, well, should they wait 90 days to get their second dose? Probably. But we've seen that with the vaccine, it is not only like any other vaccine. You can have a sore arm after the vaccine, which is sort of showing your body is working against it and helping you be protected. Some folks, like myself, when I got the second dose, I had shivering about 12 hours afterwards. I did not take anything to prevent that. However, the next day, I did take what's called a non-steroidal medicine, which is like Motrin or Aleve. But now some people cannot take those medicines for other medical reasons. They may have to take Tylenol, and there's other people who can't take Tylenol. But they were basically, I felt, relatively mild, although some people felt that they had fever after the vaccine. They felt the shaking chills, shivering, achiness, and headaches. And for those who could take ibuprofen or Aleve or Motrin, it seemed to work pretty quickly in getting them to feel better. Again, this was all temporary. The protection we're getting is really key. So we've seen that work well. Now, there are some folks that have had allergic reactions. Whether this is in some, not all, but some people who know they have allergic reactions to shellfish or nuts or bee stings or wasp stings. They carry an EpiPen with them, which is a treatment for a bad allergic reaction. They have to proceed cautiously with the vaccine to make sure they don't get that kind of reaction. It's still been rare, but overall safe with that. There are a lot of myths and rumors about the vaccine. The key thing is, I really have to emphasize this point here. Listen to what is happening in the world. Right now, there has been at least 78 million Americans that have been vaccinated already. That's 51 million have gotten one dose and 26 million have gotten both doses. Millions of people have gotten this vaccine. Honestly, if there's a problem with it, come on, 78 million people getting the vaccine. This is a safe vaccine. In countries that have been able to vaccinate their populations, we've been seeing the number of cases dropping. And this is important because we need to get ahead of any of the mutations out there or variants that are being created by infected people. Because the virus does change a little bit, and we don't want it to start to be a different virus. Right now, these vaccines are working against these mutations, which is good news. But this is very powerful numbers that millions of people are getting it. But unfortunately, there are folks that are not choosing to get it. And I've looked at this as far as, is it safe for my family? Once my daughter, who works for a grocery store, is able to get it, I encourage her to get it. She wants to get it. This is important that we emphasize it. But we've run into people that have come up with things they've heard on the internet. Please, we want to encourage people to get their facts. I've heard all sorts of stories like, you get the vaccine and you'll glow in the dark, or the vaccine was made with something called luciferase, which is from Lucifer. It's the devil's chemical, and it's just really unusual stories that actually people start to read it and they believe it, and they have to hear the facts. And in fact, some of these stories, you could explain how people misunderstood this and took it the wrong way, and we need to work on how this happens. Now, another common question is, aren't these very new? Well, the first two vaccines that we've been using here in Polk County, they've been studying this technology for about 20 years. And the way the technology worked, it was one that really lent itself to be rapidly converted into a new fight against a new germ. So this technology that had been around for 20 years, when a new germ showed up, they were able to take that technology they understood fairly well and to be able to say, let's make it specifically for COVID. So that's how they were able to quickly do it. You can't really do that with the older types of vaccines. And with this new vaccine that just came out, it's one that they've studied for over 40 years. So that's reassuring. Let me show you how these vaccines work. Again, I'm going to focus on this yellow part. This is called the spike protein. Remember, the virus makes 29 other parts and proteins that generate antibodies and irritate your immune system and attack your body. But this one part is called the spike protein. It's used by the germ to stick to your body. And it's coded for a part, is coded by one part of this genetic material showed in pink here. So what's happening is, instead of giving the entire infection, only one tiny piece of the genetic material, called the mRNA from the virus, is given in the vaccine. Now, this is very delicate. This mRNA is a very delicate chemical. Remember how I said your bodies make this all the time? And because we make so much of it, our bodies break it down so quickly after it's used. The scientists have known this over 20 years, and they know how delicate it is. They actually wrap it in a little fat bubble, a little bubble of fat, but that's why they have to keep it in a freezer, and they have to be very gentle with it when they store it and ship it and give it. So it is very fragile, but when they've studied how to give it, and it is effective when you give this little piece of genetic material, it's not the whole virus, so it cannot cause an infection. No infection, because this is not the entire genetic material of the virus. This one piece goes in, and this is a code for the protein to make that one part of the virus called the spike protein. Your body sees you making this, sort of thinks it might be an infection, and you make antibodies. And those antibodies hang around to be ready for when you get exposed in the future to the real deal, and you're ready to fight. Now, this is actually better than other vaccines in the sense that when your body is making the spike protein as if it was a full-blown infection, but you're not making the other 28 parts, you're just making this one part, the way they're coming and being made by your body is so close to what sort of looks like an infection, your body actually builds up a better immune response in things I won't describe right now, but it's more than just antibodies. It's the rest of your immune system is also recognizing this process and really helps remembering it. Keep in mind, if you catch COVID, that's just one infection where your body's got to remember what it looked like. If you get this particular vaccine, you're getting 2 doses separated by 3 to 4 weeks. That's giving a boost to your immune system to help your remembering it and probably protecting you longer. As long as the virus doesn't mutate or change drastically, this may give you and should give you longer protection than catching the germ. So we definitely recommend the vaccine for that, giving you longer protection. If you caught COVID, wait about 90 days, and then you get that extra 90 days added on to whatever the vaccine can provide you. Now, keep in mind that this vaccine breaks down and pretty much dissolves pretty soon after it does its job. It does not become a part of your genetic material. It does not impact fertility. There are folks that can have an allergic reaction to it, but it's a very small number. And that's why when the vaccine is given, you're monitored for 15 minutes longer if you had a history of reactions to make sure that everything goes safely. I will mention the new virus vaccine called the Johnson & Johnson vaccine. It is slightly different. Here you only need one dose. And one reason, well, a few reasons going on here is this has been studied for over 40 years, and the technology in general. The specific one here being used has been really studied over the last probably 10 years too, about how they were making this to create a vaccine against Ebola virus. Ebola virus has a vaccine that works very similar to this, and this has been better understood. Now, instead of using RNA, what they've done is they've taken in the laboratory, they've taken a cold virus, a virus that causes the common cold called adenovirus, and they removed all the genetic material that allows it to duplicate itself or take over your body. They removed all that genetic material, but they kept just the shell. Now, the shell is very hardy. This is actually made of more protein, and it knows how to get into your cells like a virus. But remember, it's missing all the genetic material that makes it a cold virus. They're just using the outside of it because it's very hardy. Now, that's why you don't have to freeze this virus. You don't have to handle it as carefully as you have the other vaccines. It's very tough. Now, when it's given as an injection, they've removed all the genetic material that made it a cold virus or what was an adenovirus, and instead they've put into it the genetic material for just one part of the COVID virus. And guess what part that is? It's the spike protein part. It's the genetic instructions to make only the spike protein. This goes into your cells, and what happens is your body takes this DNA, turns it into mRNA, and then the mRNA goes into the machinery of your cells, and your body follows the instructions and makes the spike protein. The spike protein comes out, your immune system recognizes it as not one of your proteins, builds up antibodies, and now you're ready to fight a future infection. To me, it's amazing how they've been able to design this and to do it in such a way that has been studied, it's been safe, and it's provided protection. I am not concerned that it's slightly lower than the others. I think it was 94 for 95% protection versus in the 70%. This is going to make a huge impact on dropping the number of infections. And even though the overall protection rate was slightly lower with this Johnson & Johnson vaccine, they have not seen the serious infections or hospitalizations or deaths from COVID if you've been protected by the one shot of the Johnson & Johnson. I still need more information about the allergic reactions. I'm feeling that this is going to be less allergic reactions, but I actually want to see a little bit more information there. Okay, just to wrap up, we cannot let our guard down. This is still a very critical stage where, as you've seen nationally, COVID cases are creeping back up a little bit. And here in Lakeland, we were under 100 cases a few days ago. Now we're over 100 cases. We got to be very careful. People are still catching sick. Even though you see a curve going up like this, and now the curve is coming back down, there's still 50% more cases on the other side of that peak, on that curve. That's a lot of people who are not going to do well, and they're going to spread it to people they love, and they may end up getting an infection that they've made it this far, but then they end up in the hospital because we took our guard down. So a couple things. Please, if you're going to be indoors, especially with low ceilings, not a lot of air movement, and people are not wearing masks, please avoid those places. Or if you see somebody not wearing a mask, try to stay your distance from folks that are not wearing masks. They may have the infection. They may not know they have the infection. They may think they're protected. They may even say they're vaccinated. But still, even if you're vaccinated, you can come across the germ. The germ will try to infect you, try to make you sick, will try to duplicate itself, but your immune system is protected because you're vaccinated, but it doesn't mean that the infectious germ may still come out of you. So even if you're vaccinated, still for right now, wear a mask because there are cases of COVID in Polk County. So it's very important. If you're going to a place where you don't feel you can control your personal space, try to avoid those places. You want to go to a place where if you feel that people are getting too close to you, you can walk away, you can move around. Or if you're, try to avoid places where people are going to be yelling or shouting or screaming or singing, without masks on. That's problematic. And if you feel that, if you go someplace and there was a cover charge or there was a financial penalty for leaving, or you drove so far to get there and you don't want to leave, that's going to impact your decision making on whether, if you see things that don't look good, like people are coughing, don't look too healthy, or not wearing their masks, you may not leave when you really should have left. So that's a lot of information. I think we'll go back to Sarah and see if there's some questions or things I could review or hot topics.
Thank you so much, Dr. Haight. We really appreciate this update. We did have a couple of questions. The first is, if a person has received both doses of the vaccine, or even one dose, could that cause them to get a positive test result?
Absolutely not. That's a great question. Getting the vaccine will not cause your test to turn positive. If you get the vaccine and you don't feel good, you may have caught COVID. You may have been one of the 6% that, even though you're vaccinated, you still caught COVID. Generally, you will not be very sick, but you may be contagious. You may be sick. You should stay at home, and your test will be positive, and it would be accurate. The vaccine does not cause a positive test.
Okay. Another question is, how often is someone going to need to get a vaccine? Is this a yearly thing, every 6 months? Do we know that answer yet?
Some of the early information was at least showing protection that was projected to be 2 years. That is in the setting of not seeing a lot of mutations that were tricking our immune system or the antibodies being made by the vaccine. So we're still going to have to wait and see. I think with what we've seen so far is the variants that are out there, the mutations that are out there, there is protection still. And this is not a virus that mutates as much as the flu virus. When I showed you that picture of the genetic material, that long yellow strand that was 30,000 pieces long, well, the flu virus, its genetic material is broken up into 8 separate pieces. Well, that makes it pretty easy for when that virus infects an animal or a person with maybe another flu infection. It interchanges those genetic materials pretty easy. And what pops out on the other end could be a pretty different virus. And that's why we need a flu shot every year. The genetics of the flu changes, and the copying machinery, the virus uses its own enzymes to copy its genetic material, and it's what you would call a sloppy copier. It's not like a Xerox, and it intentionally produces different copies, whereas the coronavirus is a little better at that, but still it does make intentional mistakes. So evolutionarily speaking, it evolves, but not as much as the flu. So we'll still need the yearly flu vaccine for right now. COVID, I'm hoping we will not need it yearly, but we have to wait and see.
Okay. Someone else asked about getting the vaccine if they're under 65, but they have had a medical condition such as cancer in the past. Like, how do they get on the list? Is there a form? What can they do?
Yeah, certainly they have tried to outline the highest of high-risk categories. I mean, obviously starting with the people giving the vaccine, you want them to be vaccinated. You wanted the people that are caring for the sick to be vaccinated. Moving on to over 65, then people under 65 who have chronic conditions. And there's the question. They've named a few conditions that we know of, being very overweight, having heart and lung disease, knowing that you have diabetes. They've added some to this. And when you start to add certain diseases like, I've just had a heart attack, well, that may not appear on the list. Just having high blood pressure. I am constantly trying to say, as long as we have the vaccines, let's try to get this vaccine into as many arms as possible. I think it will open up very quickly now as you see teachers over the age of 50, law enforcement, EMS over the age of 50 are now eligible. This is just a state rule. I think that we are obviously following, but very soon there will be enough vaccine to open it up. And I would just keep trying to get that vaccine for everybody. Again, it's age 18 and above for most of the vaccines, but there is one vaccine that's 16 and above. They are studying it in children right now who tend not to get as sick, but we do want to get that protection to as much of the population as possible. Please keep trying, register for those sites, those private companies like Publix and Walmart. Keep trying to get in.
And the website is register.polk.health for vaccine appointments? Okay.
I think so, yes. But
okay.
Yeah, doing a search would find that.
Okay. Are there any other questions? I think that was all from the chat box. Anybody else have a question?
Yeah, just unmute your line if you had any questions. I think we've all had our personal stories. I had to, as you're thinking of questions, please think of a question. But even that one about, there's nanoparticles that track your location. I can only imagine how that, that kind of myth can get started. But, remember I told you how the little piece of mRNA is very fragile? They wrap it in a tiny bubble of fat. Well, another word for tiny is nano, and another word for fat is lipid. So they do use that term in making the vaccine, that there are nanolipid particles that contain the genetic material that's the vaccine. That's just a descriptive term, but it doesn't mean that it's the nanoparticles that you see on Star Trek when the Borg invade a body and have these little robots that are part of science fiction. That's just not fully understanding it. And the other story I'll say is the glow-in-the-dark one was sort of a fascinating story. Over many, many years, decades, scientists had known that it's amazing that fireflies glow in the dark. You see a firefly, it glows in the dark. Well, why is that? Well, many years ago, they found out that fireflies have a chemical in it that they named the chemical luciferase. And luciferase takes energy and produces light. It's inside the firefly. Well, they were able to isolate that chemical to where they could attach it to things that would stick to chemicals. And when you're working in a laboratory with very tiny things, how do you know if you've made the tiny thing that you're trying to make? Well, you could take something that sticks to your chemical and attach to it the luciferase. And if you think you made something and you put this solution in there and you wash it away and it does not glow in the dark, well, you didn't make your chemical. But if you do put this in there and the glow-in-the-dark sticky thing attaches to the chemical and you wash it and it still stays there, it glows in the dark. And you've proven that whatever process you use made the chemical you were trying to make. This is used in all sorts of chemistry. Well, yeah, they sort of used it when they were trying to make any kind of, chemical. And you see that in the research articles from dozens and dozens of years ago. They do not use that when you're making the vaccine itself for the actual being used in people. So you could see how somebody who wants to try to stir up trouble or create, doubt or come up with something like that, they find these kinds of things in the writings of scientific writings, but they don't connect all the dots to where this is something that is not even a fact. It's not even true, but it makes for a good story. And then you say, oh, luciferase sounds a lot like the word Lucifer, and therefore it must be connected to Satan. I mean, this is really sort of sad that we get these kinds of stories out there, and it's been frustrating. They'll say things like the vaccine was made with aborted fetal cells. Well, the Moderna and the Pfizer vaccine were never, ever used. Even in the development of the vaccine were aborted fetal cells ever used. But when people say that, you can't fact check them immediately. They say it in the grocery store line, and they say that that's why they're not getting the vaccine, but it's a totally untrue statement. We've got to basically calmly say, No, the vaccines are safe. They're effective. Over 78 million people have received it and have done well. And we need to do this to bring an end to this pandemic. Simple as that.
All right, thank you so much. Does anyone else have a question? All right, well, Dr. Haight, we cannot thank you enough for sharing this with us. And just, I know I speak on behalf of everyone, thank you, and to everyone in the healthcare community for what you have done over the last year and what you continue to do. We know it's been quite a journey, but we are so appreciative, and we just thank you for keeping us informed. So, and thanks to everyone for joining us today. We appreciate it.
Thank you.